Welcome back, everybody. Before we get into today's video, here's a quick disclaimer.
So as we mentioned in the first video, we are PT students. We are not certified or licensed physical therapists yet, but we are providing you with researched information that we have learned in our classes by clinicians and by other therapists. If at any time you feel pain or discomfort during any of these exercises, please take a break and try again when you're feeling better, or refrain from performing any specific exercises that are painful for you. Any questions can be directed to the email listed below at the bottom of the screen.
Okay, so again, throughout these next 8 weeks, we're going to be progressing with some of these exercises that are going to continue to focus on mobility, strengthening, and endurance. Some of these exercises may prove to be a little bit too challenging for some, but we're going to be continuing to demonstrate some alternative methods that are going to achieve the same goals. Today, those exercises are going to be seated thoracic extensions, standing hip extensions, and then, you guessed it, stair climbers. So with further ado, I'll kick it over to Nick here, and we'll get started with the first exercise.
All right, thanks Kyle. So the first exercise we're going to be performing today is thoracic extensions. So for this one, we're going to be performing 3 sets of 15 repetitions each with about a 10 second rest in between. Feel free to take more break time if you need. So what Kyle's doing here is notice how he continues to breathe while performing this exercise, and that's true for all the exercises we're going to be performing. He's going to be extending through his back and his hips, and he's also pushing through his hands to get more extension there. Now, if you don't have enough motion in your shoulders to perform this, that's fine. You can do this simply by leaning over the back of your chair. Also notice how Kyle is seated in a very stable chair. This is an exercise that we don't want to be performing in using a chair with wheels on it for safety purposes. How's that feeling, Kyle?
Pretty good. Just a few more left.
Wonderful. So with this exercise, what we're trying to do here is get you moving. The main goal of all of these exercises is to get your joints moving, get your muscles moving, because when we're sitting in a seated position for a prolonged period of time, everything tends to tighten up and become hypersensitized. Feels good?
Yep.
All right, so we'll take about a 10-second break here. I'll just continue to talk through some of these exercises, okay?
Okay.
All right, so you can perform that exercise. What we'll show you here for the second one is an alternative that you can perform. So if you have a belt with you or something that allows for you to wrap around yourself and use, that will work for this. So this could be used if you don't have a chair that has a stable base on it. So what you're going to do with this is you're going to wrap it around your back as Kyle's doing. You want to get it to about the mid to upper back, and what you'll be doing with this one, just as Kyle has, is just underneath your arms. So you're going to be tensioning that band as Kyle's doing, and then you're just going to be leaning over the back of it, just like that. So again, this band will be utilized as the back of the chair. So this allows us to utilize the chairs with wheels on them while maintaining a safe and proper positioning. Feel good, Kyle?
Yeah, I think I like it better than the chair.
Good. So again, as we mentioned, this is about getting you moving a little bit more. So when we sit in a slouch position throughout the day, our spine gets in an abnormal position. Some of our nerves and things that are innervating, things that are within our spine,
Soft tissue structures.
right, and joints tend to become hypersensitized, which can lead to chronic pain with prolonged use of them. So this motion, again, is getting you moving and out of those prolonged positions.
And remember, you can do this throughout the day as well. We're doing 15 reps here, but throughout the day, if you're feeling stiff, go ahead and do 10 of these, and you might be feeling a little bit better. So we have one more variation to show you, and we're gonna do that for our final set.
All set?
Yep, let's do it.
All right, Kyle, go ahead and stand up. So for this next one, again, if you don't have a stable chair, and if you don't have a belt or anything, this one is a very simple one that can be done. So go ahead and stand up out of your chair. You're going to be placing your hands on your back, and you're going to be feeling for these bony prominences that are back there. You're going to be pushing through your hands and leaning back over your arms. And again, the goal of this is just to get you moving. And as Kyle mentioned just previously, we have sets of 15 reps on there, but this is one of those exercises where you can't do enough of it. So if you feel like it gives you relief, if you feel like it's making you feel better throughout the day, you can do this as much as you want and with as little time in between for rest as you need.
Now I'm extending pretty far back. If you're starting to have pain or you start to feel unsteady, don't go quite as far back. Just move to where you feel comfortable and then return to your resting position. Last one.
Wonderful. So this completes our first exercise, and now we'll be moving on to our next. All right, so the next exercise you will be performing is a standing hip extension one. You will perform this for 2 sets for 20 repetitions on each leg with about a 10 to 20 second rest in between, and feel free to take more rest time if need be. So notice what Kyle's doing here. He's going to put one leg forward and one leg back. The back leg is going to be the one that you'll be stretching. So the goal for this one is we don't want to extend through our lower back. We want to be pushing with our glutes so that we feel a stretch on the front side of our leg. With this stretch, what we're trying to focus on is hitting the hip flexors and the quadriceps. So when we talk about the hip flexors, the main muscle that we're talking about is the psoas major muscle. This muscle attaches to our lumbar spine, wraps around and attaches to the inside of our femur. When we sit for a prolonged period of time during the day, that muscle, along with the quadricep muscles and some other muscles, become pretty tight and sensitized throughout the day. When that happens, those muscles, especially the psoas major that attaches to the lumbar spine, can cause the part of our spine to go into a hyperextension motion, as Kyle was showing before. When this happens, we close some of the joints and facets that are in our spine, which can pinch some of our nerves and lead to some chronic pain in the future when we do this. So, if you're not able to perform this exercise standing up, we're going to show you 2 variations that you can do that focus on doing the same thing. So Kyle, the next one that you're going to do is a half kneeling position. So this is the same concept. You'll put one leg forward, one leg back, and the leg that's back is going to be the one that is being stretched. So again, we don't want to be extending through our low back. We want to be pushing through our glute to fire and feel the stretch on the front of our leg. Another alternative that we can perform is seating in our chair. So what Kyle's going to do here is he's going to scoot to the edge of his chair. He's going to place one leg back, and he's going to go ahead and lean forward into that. So again, same concept for all these. We want to push through our glutes, we don't want to extend, and we want to feel the stretch on the front of our leg. So for both of these ones that are performed in our chair and the half kneeling, you can do this in front of your desk so you have something to lean into and push through. How'd that feel, Kyle?
Pretty good. You just want to emphasize, make sure you're really keeping those glutes tight, breathing, and keeping your core tight as well. That's going to prevent your pelvis from tipping forward, which, as Nick was saying earlier, is what's going to make your back extend. All right, so we'll see you in the next exercise.
All right, finally, we will be starting with your next exercise, which will be stair climbing. So, you're going to be performing this for 2 sets of 60 seconds with about a 6-second break in between. If you have to go from your desk area to a stairwell, feel free to pause this video and go and do so. So notice how Kyle is doing this. He's maintaining a good upright posture. He breathes on his way up and breathes out on his way down. And what he's doing here is making sure he's firing his core, making sure it's tight so he's not slouched over when doing this, maintaining good spinal position, and maintaining safety.
And if you get tired during this at all, just take a little break and then get right back at it.
Also, if you're finding yourself having trouble balancing during this exercise, feel free to use a chair, or if you're close to a wall, you can use a wall for balance as well. If you feel like your safety is pretty good and you have good balance while performing this, feel free to put your hands on your hips and feel for those hip bones on the front. The goal is to make sure that you're maintaining a neutral hip position and not going into an anterior or posterior tilt, as we mentioned before, so that we're not stressing the muscles and the joints in our lower back.
Okay, so now for the second step, we're going to show you a couple alternatives if you don't have a stair or a stool nearby.
So one alternative we're going to show you is just a standing in place hip flexion. So what we're going to be doing is just doing marches, same thing, do 2 sets of 60 seconds with a 6-second break in between. Again, Kyle's got his hands on his hips, making sure that his hips are in a level position. He's firing his core so that he's bringing up his legs with all those muscles and not in a slouched position. He's still breathing, and he still has his nice upright posture.
This might be a little bit too hard, so if it is too hard on your core, just don't bring your legs up this high. Just don't want you going that full 60 seconds. Just maybe bring it up about halfway to your waist.
All right, and that completes our third and final exercise for the day, and we'll see you next week.